So you get these transformations that I have not seen with any other treatment modality. And unlike most researchers who find one particular treatment method and beat the same treatment method to death by studying the same damn thing over and over again, my career has been that I'm interested in what else might be helpful. So I've studied yoga, turned out very well. I've studied EMDR, I've studied theater groups, I've studied neurofeedback, I've studied various psychiatric medications. But what we see in the MDMA is really more profound than anything else we have done.
Hello, everyone, and welcome so much to our first episode in our new podcast by us at the Psykologvirke. Psykologvirke, we are a psychotherapy clinic based in Oslo, Norway. My name is Øystein Ottesen Nøtvedt. I'm a clinical psychologist here, and with me is also my colleague Ivar Valderhaug Goksøyr, clinical psychologist and the founder of Psykologvirke. So Bessel, first I'm just curious, how did you get involved in this research in the first place? What kind of stirred your interest?
I don't quite remember how it started. It started 15 years ago when Rick Doblin and Michael Mithoff actually consulted with me about what they thought about using psychedelics for PTSD, and we had a very nice lunch together. And I said it was a great idea, but they shouldn't do it because these drugs are illegal. And I went through the previous incarnation of doing psychedelic therapies. I actually happened to have Timothy Leary's old office at Harvard at some point. And of course, I'm a child of the 60s, so I had my own psychedelic experience as a young guy. And then in 1994, I did a symposium at the American Psychiatric Association where I called together a lot of the old LSD researchers and have them review what they found. And I found at that point that they were some of the most depressed people I had ever met, because they had started off with something fantastic, and then the politics took over and these drugs were declared illegal. And so these poor guys who had done that research felt that they had wasted their lives. And I told Rick and Michael, don't do it, because you'll probably feel like you wasted your life also, because the politics of using these drugs is just too cumbersome. And so, much to my astonishment, the two of them were able to get permission to do a phase 1 study that worked out quite well, and then do a phase 2 study. It was mainly Michael Mithoff at a point. And then when they started a phase 3 study, they asked me if I wanted to be principal investigator of the Boston side of the study. And I said I'd be delighted. And I mainly joined at that point it's not my natural character, but as a weight to keep things very serious and very strict, because I had seen how it blew up last time. And I'm still worried, even with our current data, that our societies will have a hard time tolerating this amazing transformation. And the fact is that people will change in a way that our capitalistic systems may not be happy with. And one of the recurrent findings, both in Robin Carhart Harris's psilocybin studies and the Hopkins studies and now our MDMA study, is that when people take these substances, their perception of the world changes, and they become much more focused on loving each other and on not working so hard and not being so harsh about things. And so it goes in a way against some of the core tenets of Western, particularly American culture, where you just work yourself to death and love takes a secondary role. So it continues to be an issue of great concern about what will happen for this and how the world will accept it. In the meantime, we did finish a study and the results were spectacular. And I don't know whether you saw my presentation at the trauma conference last week, where I actually presented the data that are not published yet uh, about self-compassion and self-regulation and alexithymia and understanding yourself. To my mind, the data I presented last week were the most interesting data yet on uh, MDMA, in that measuring whether PTSD improves is sort of like blah. We know how to treat PTSD with other methods, and MAPS likes to say, "Oh, we don't know how to treat PTSD," and that's because they have a perception of the Veterans Administration that only follows methods that we know don't work. But for those of us who work in the civilian sector, we have very great successes with EMDR and brain spotting and neurofeedback and internal family system therapy. So the PTSD per se is not our great challenge. But the great challenge is the issues that my group and I delineated over the years of the secondary effect of interpersonal trauma, namely on your capacity to feel safe with people, to love yourself, to find yourself a worthwhile human being, to not be frightened about all kinds of different things, to be open, to be curious. And that is not what's being measured in the main study that makes the big presses. But we did a secondary data analysis. And I've done research for 50 years. I've never seen anything like it. It is stunning.
Wow.
And the data that we collected very much are in line what we saw clinically in our subjects in our study. One of the great pleasures of doing a study like this, our sites are small. I imagine your site in Norway will also at the end be relatively small, because it's very expensive and very complex to enroll people in this very difficult protocol. So we have only a limited number of people. But every single subject that we saw had a remarkable experience of going very deeply inside. And this is no picnic. This is not an experience like, oh, we see God and we see great transcendent realities and we feel so much better. People actually go into their trauma and they lie there and they suffer as they go into it. But the natural defenses that keeps people from going there seem to dissolve with the MDMA. So people have their experiences and say, yeah, I was raped when I was 3 years old. And then they go like, this poor kid, this poor child who I once was, that I had to go through it. And the big thing that we seem to see, and that our data also seem to support, is that the MDMA is capable of giving people a very deep sense of self-compassion. So rather than hating themselves for being as weak as they were when it happened, or not putting up more resistance, or taking it so hard, all the different things that people blame themselves for when they get traumatized, they go into a state of deep self-compassion where they feel the depth of the pain that they're carrying, and to say, yes, this happened to me. Isn't it amazing that I'm still alive after having gone through this experience? And that experience happened 5 years ago, or 10 years ago, or when I was 3 years old. But today, it is June 2021, and I'm alive. So you get these transformations that I have not seen with any other treatment modality. And unlike most researchers who find one particular treatment method and beat the same treatment method to death by studying the same damn thing over and over again, my career has been that I'm interested in what else might be helpful. So I've studied yoga, turned out very well. I've studied EMDR, I've started theater groups, I've studied neurofeedback, I've studied various psychiatric medications. But what we see in the MDMA is really more profound than anything else we have done. Indeed, because of the Federal Drug Administration, we call it the treatment for PTSD. But it's like some other, like yoga and neurofeedback study. It's not a trauma treatment. It's a self treatment. It's a treatment about this is who I am. These are the parts of my life that I've experienced, and so it happens to involve trauma because that's what we select for. But it's not a trauma treatment. It's a mind expanding treatment. And so, and the whole word post-traumatic growth, I don't like that term. I see it as a counter-transference term. There is nothing great about getting gang raped or beaten up by your father. Uh, you know, I think that word post-traumatic growth I don't like at all, actually. Yes, traumatized people have to find very creative ways of dealing with all that misery, but I don't call it post-traumatic growth. I call it they know stuff that other people don't know and need to live by it. Here is in the medical model, which I've sort of left, uh, your basic premise is I'm normal and you're screwed up. And I'm going to give you a treatment at the end of which you're just as normal as I am. I think
Mhm.
that's a crazy premise. We all are suffering human beings. We all have had major disappointments. We have had hurt. We have had pain in our lives, some more than others. But we're dealing with we deal with the human condition, and some people get stuck because life got to be too much of them, and the unlucky ones, and some of us were lucky enough to have the resources and the support to deal with our the misery that came our way. But I don't see this normal people versus abnormal people, traumatized people versus non-traumatized people. That's not my perception of the world anymore.
Right. That's an important point. So how the language we use can be used to alienate or create a sense of alienation or an us versus them. The same thing with treatment resistant, that kind of term, which kind of
Oh
puts
yeah,
the blame on the individual
yeah.
rather
The
than.
treatment resistance is what people should say. I have not learned yet how to deal with a person like you, and the treatment that I know uh, are failing you to get better. So rather than putting the onus on that person who comes to you for help, you say, "Oh, I've not learned enough to do it yet." And then people apply their stupid little treatments and say, "Oh, the patient is treatment resistant," instead of saying, "I'm resistant to learn new things
Mhm.
as a therapist." Yeah.
Mhm.
That's a great point, and I wanted to ask. Maybe it's a good time for me to chime in a bit, Øystein. As part of the training of being a therapist in these studies, also the therapists are allowed to enroll in a training, like having MDMA-assisted psychotherapy as part of the training in the FDA-approved protocol. And I know also you, Bessel, have undergone that like I did. And for me, for sure, it was a profound experience. And even though it came late in my involvement in this field, it for sure was a important, how to say, confirmation that I'm on the right track, devoting some time of my career and life to promote this work. Would you like to share some of your own experiences doing that training?
Well, I'm actually curious to ask you what your experience was. But let me tell you about my experience. Uh, so, I have a friend who is a former commissioner of Child Protective Services in Massachusetts. And he told me that a number of years ago, he went to Bolivia and took ayahuasca. And while he took ayahuasca, all the abused children in the world who ever lived came to visit him. And I went like, oh my God. And you live to tell the tale because nothing makes you more desperate than seeing how many abused children there are in the world. And so my friend told me extensively about his experience and how at the end it helped him. And I said to him, well, good for you. I hope that never happens to me. Well, I was wrong. I took my MDMA, which is probably not as powerful as ayahuasca, and all the traumatized people I had treated came to visit me. Not in a cognitive way. I just experienced all the pain that people had done to me in my 50-year work of seeing traumatized people. And I was just lying there going, oh shit. Oh no. Are you sure this is a party drug? Because I just felt all the pain that had been unloaded to me. And up to that point, people ask me all the time. Yesterday I was still on the podcast, same thing happened. People say, so how do you deal with all this stuff? And I always said to people, oh, as long as you have a good support system and as long as you have a good marriage and you have good friends and you get to talk about your stuff, it doesn't really become part of you. Well, I was wrong. And so on MDMA, I got to see that indeed this stuff had come inside of me and had burrowed itself into my very core of my being. And so it was a transformative experience where I got much more respect for what it's like to actually carry all this pain that people dump on you. And I think it affected me, my perception of things. And to some degree, that is very similar to what our study participants also experience. They experience their trauma as not a picnic, but they say, that's how it is. That's what happened to me. And so that was my experience. And what's also important, and you know it or you will know it, as you do study, the people who are your guides or who accompany you are just there. They don't do very much. Actually, you do all the work. Michael Mithoefer just spoke at my annual conference, and he said something that really resonated with me. He said, I used to be an emergency room doctor. And all I did in the emergency room, people would come in wounded and hurt, and I would clean their wounds. And so by cleaning their wounds, I did not make the wounds heal. The body heals its own wounds. As a doctor, the only thing I did is to clean out the side of the lesion so the natural healing processes of the body would be able to take their place. And boy, that's exactly how it is. As a therapist, you don't do the healing. We shouldn't even call ourselves healers. We should call ourselves guides or wound debriders, to make it possible for people, for the healing process to take place. But you do the healing, and all people do for you is to be there as you go through this very painful process.
Yeah, that's beautiful. I can relate at least partly to your experience. Part of it was deeply personal and discovering more trauma in my own life than I actually realized in a way. Or there was nothing new coming up, but really the depth of the things that I already knew about and the impact they actually had. And it was quite amazing after having had quite a lot of useful therapy before in my life to see how much there still was to see, and in a way how easy it was to see through everything and straight to the truth.
It's remarkable, because we have our internal ways of coping by walling things off and putting it away. And of course, that's very good for people. People need to do that. But the MDMA allows you to be, one way of putting it is to be more honest with yourself and to allow reality to come in. The reality that at that time may have been too hard for us to handle.
Yeah, for sure. Yeah. I also had some part of the experience really taking in all the pain of all the people living today and all our ancestors. And in a way, it was a really hard experience, but it was also a lot of comfort in it, in a way, and a lot of shared humanity. In a way, just realizing how much we're the same, and there might not be so much special about my pain. It comes in a different form, and and of course there are levels, and some people are more unlucky than others, but still there is something profoundly human and common. So I really enjoyed what you said about this distinction between the patients and us, and all this also it's really important. And I would really like to see also studies being set up for mental health professionals with MDMA to give people that possibility to experience on such depths their own psychology.
So, you know, I'm really glad what you said, because it's all also my experience. What I'm worried about indeed is that once people hear you and me talk,
Yeah.
they'll go like, "Oh my God, I'm going to do this weekend and do it."
Sure.
And I wonder how we can sort of keep these things contained. And so I think we're lucky to be here at the beginning of this revelation, basically, when things are still well organized and nobody's trying to make money off it yet, or nobody's trying to exploit it yet. So I'm worried what will happen to this. Because last time people had the same experience back in the 60s. And then it's really, people got so enthusiastic that things went out of control. And as I hear you speak, I go like, where can I get this damn drug? So the question is, are people capable of managing the profound manifestations that come from this work, actually?
Yeah, sure.
Yeah.
I would also like to add that even though the experience itself was profound, and I really felt that some pieces were healed, like some symptoms were gone of anxiety. I didn't even know was anxiety. I thought it was kind of a motivation. It was trauma related when it came to episodes or things involving responsibilities. Always triggered anxiety in me, even though, you know, I'm pretty good at spotting anxiety in my patients, but this one I thought it was just motivation. And of course trauma related from you know, taking a lot of responsibility from a young age, as many psychologists and other helpers do. You know, so but still, you know, life is also recognizable after the experience, and a lot of stuff is, you know, a work in progress, and some things are not worked through at all yet.
Yeah.
So the idea of it being a wonder drug or a magic pill is of course, in a way, it is remarkable, and it does very deep things, but there's also limitations, and the work has to be done.
Yeah, and I think there's a lot to be learned in this regard also, in that the protocol for our study, as you know, is people get 3 sessions. You and I, as investigator, only got 1 session. And actually, I wish I had 3 sessions. And I'm sure I will before too long. But with many of our subjects, their histories were incredibly complex. Their lives were complex beyond our wildest imagination. And we saw them grow tremendously, but I felt like a number of them should have had some more sessions. And so the protocol confined them too much along the lines of what you're talking about, is that these should be experiences that should be used and should be grown into and revisited on a regular basis. One of the main things that I sort of am left with from our study is that, and COVID has really had a major impact here, is that we have been so isolated for a long time. Yeah? And I think what we need more of is retreat centers and places where we can go to have these very sacred experiences on a regular basis. And our societies should actually have centers where people can go, not only on the basis of how much money you earn, but to make it available for people. You can actually take a retreat to rediscover yourself. And I think we need to have more context in which this can occur.
Okay, but thanks for sharing, Bessel. And of course, this is our personal experiences. It can be interesting, and it can be interesting for the listeners to get to you know, to know you a little bit. But still, the main thing here is, of course, you know, the data, what they're telling us, and why we should pay attention to this modality, and maybe also get involved and do some work and support for it. So you mentioned, you know, some great results presented at the conference. Would you like to go into a little bit more detail there, what you found?
Well, so the result in terms of numbers are interesting. the results in terms of experiences are even more interesting. So the so-called science piece of it is the little numbers. With a little rating scale we give people that we hope will capture some aspect of people's internal experience. Of course, rating scales rarely do that. And self-report measures rarely do that. But the data are that 2/3 of the people lost their PTSD diagnosis. In my studies, that is one measure I use, but actually I use another measure, and that's a measure of resolution of the trauma. And in the MAPS analysis of our study, we did not look at that actually. It's not whether your CAP score has a certain percentage drop. The first time I did EMDR research, the first time I was confronted with the notion that patients told me, it is over. The trauma is gone. Not my PTSD score declined by a certain percentage, but people said, yeah, it's over. I was molested as a child, but I'm not molested now. It used to sit in my body, but no longer sits in my body. And that is very much the experience that we saw in our exit interviews with our subjects, but our measurements did not capture that. Our measurements just look, what is your PTSD score? But so the secondary data analysis to me was fascinating in that the issue of self-compassion just was gigantic. That people stopped judging themselves, and people stopped beating up on themselves, and people had a sense of internal generosity, and they had the capacity for self-acceptance, and with that of other people, accepting of other people. So they no longer were defending against parts of themselves that they couldn't stand and projecting on other people. They saw, oh, you get angry just like I do, or you get uptight just like I do. So you get much more of a sense of we are all in this together, and we all have our crazy reactions. And so these secondary measures really got that very nicely. One thing that really struck me in the secondary analysis was the Thymia scale. Thymia is a very complex word that most people don't know what it means, but what it means is a lack of capacity to identify what you're feeling, to have no language for what you're feeling, which is very highly correlated with childhood neglect and abuse, basically. I see this in my grandchildren growing up, and what they see is these children learn how to identify who they are and to talk about what they feel and what makes them feel good and what makes them feel bad. It's very much a part of becoming a well-functioning human beings is that you know what this creature that you inhabit feels and knows and needs to be done. So alexithymia is a measure of not knowing that. And alexithymia is very much something correlated with people having no caregivers who help them to mirror them and say, this is what you're feeling and this is the impact, and there's no dialogue. Or my favorite phrase there is what John Bowlby said. Bowlby said, what cannot be told to the mother or the other cannot be told to the self. So as long as you live with caregivers who don't see you, that really impairs your capacity to know who you are and what you're feeling. And indeed, the vast majority of our subjects had terrible alexithymia scores. And then they have 3 lousy sessions of MDMA, and they know what they're feeling. And they have language for their feeling, and they can articulate who they are. You know, this is a huge issue in the field right now. I don't know if you follow the work of my close colleague and friend Ruth Lanius, who is talking more and more about the neuroscience of self-experience, self-knowledge. And so the latest neuroscience stuff in the area of trauma is very much about the loss of sense of self that comes with trauma. And what you see in the MDMA, people have a self. They say, this is who I am. This is what I feel. This is what's important to me. That's what's unimportant to me. And I'm no longer dependent on what you feel to dictate what I feel, but I have my own feelings. So we saw this in our study clinically, not in our outcome measures. For example, we had some people who were in very nasty, abusive relationships. And rather than saying, my husband or my wife is such a terrible person who does all these terrible things, they said, I'm actually married to a very dysfunctional person and I need to negotiate what I need in a calm way because this is what I need. And so I was astounded how two of our subjects were able to negotiate exiting their relationships in a very calm and mindful way without blowing up or becoming threatening or becoming all uptight. They say, this is what I need and this is what we can do right now. I see who you are, so this is how we can negotiate our relationship. It was really stunning, that sense of self that came online. And we have some data that I'm actually trying to write up right now, which I hope will become a very important article in the field. Yeah.
It's a really interesting data and experiences you're telling us. So we were you mentioned the healing coming from within and the MDMA and the therapists acting as kind of a nurturing environment for that process to take place, in a sense.
The word guide is a good word, I think.
Right. Mm-hmm.
In the same way you go mountain climbing, you have a guide, but you have to do the damn climbing.
Right. So guiding the process inwards in a way for the drug to make its work. So we have this term, the inner healing intelligence, right? In this research, where the healing capacities of the individual comes forward and manifests really as a bodily process as well, right? Of course, your famous book, "The Body Keeps the Score," not perhaps only for people with trauma, but for all of us, that the body can be forgotten in a kind of hyper intellectualized culture as well. Could you say a bit more about what these participants are experiencing in terms of changes in their body, or are there movements during the therapy, unfinished movements, perhaps, or different way of relating to the body?
Well, it's a very good question. It's also a question that I have, and to my mind, our team, and I think most of the teams doing this work, are not very experienced body therapists, and so you see these reactions in the body, but I think very few people who are doing the studies right now are really trained enough to really use the bodily sensations to comfort people. They really don't know touch, and they don't know about the experience of touch. And so this dimension is a terribly important dimension, but in our study, both in the training and the outcome, this has been insufficiently paid attention to. But it's interesting, as you and I are talking, I'm getting messages from Ruslanius and her team, because we have decided to do a touch study to see how touch and body sensation is critical in trauma, because basically our field is still, oh, there's an event in your head, let's do some cognitive behavioral treatment on it. And what you see in MDMA is a deeply somatic experience. At some point, in my own experience, actually, my body started to cramp up, and I was with these lovely guides, but they tried to do something, but it was very awkward and it felt awkward. But my wife happens to be a body psychotherapist, a body therapist, actually. She's a body worker. And so she happened to be in the neighborhood, so they called her in and said, will you please work with him? And so she worked with me to help my body to calm down. But I wish, as we train people, that we would train people, the therapists or the guides, better on how to hold people to feel that, make their bodies feel safer. Yeah.
It's very interesting, and perhaps the sense of safety in one's own body, or kind of the demarcation between myself and the outer world, can become blurred after a trauma where one's integrity of the body has been violated, right? So is there a sense of MDMA making the body a place to be inside without like the horror of anxiety, right?
And I think to some degree, the current protocol helps with that, but I think we can do better in that regard. And so I'm curious what you guys will run into in Norway and Holland as you do the studies in Europe, so we can have this conversation 2 years from now to see what else do we need to be better guides.
What are your primary concerns? You have mentioned some of them regarding how will kind of neoliberalism take this, in our culture, maybe the Protestant working ethics.
Being a firm victim of the Protestant ethic, I accept that. What I'm most worried about actually is the capitalist system, and that, which of course is less prominent in Norway in some ways, but that people will run out, as they're doing right now already with ketamine, and start making a lot of money by the careless administration of these drugs. And I think, that's very much how the pharmaceutical industry took over psychiatry. And to my mind, psychiatry lost its soul in its marriage to the drug industry. I think psychiatry has largely become a bunch of drug pushers, but we have lost the mind. And here we have a chance to reclaim the mind, but boy, am I worried about profits and that sort of stuff will really get in the way of creating optimal healing environments.
Then you're specifically thinking about shortening the psychotherapeutic package and just giving the drug without therapists with proper training and without proper preparation and integration.
What we see right now in ketamine, for example, is that people I know have gotten ketamine in the mail. I know somebody who was a very wonderful person who became very depressed. He got ketamine without supervision. His wife had just left him. He lived in an apartment by himself, and he killed himself after taking ketamine. I think what's fascinating about our study is that we had no adverse side effects, which really surprised me, given how painful and intense my personal experience was. It sounds like yours was along the same lines, and I think I can't imagine having done this journey without people who I trusted and felt safe with doing that. And I'm really worried that people will do this by themselves or with friends or in unprotected situations, because you really open up Pandora's box. And when you open up that box, you need to have people who really help you to contain it for you. And part of it is that makes it very expensive. As you know, the study that you're doing is enormously expensive because we pay 2 therapists an enormous amount of money to be there all the time. My organization, the Trauma Research Foundation, is very interested in the fact that this whole trauma field started with lay people. It started in the feminist movement in Cambridge, Massachusetts, where people wrote a book called Our Body, Ourselves. When I started in this field, we had peer support groups for veterans who did much better with each other than professionals did. Most of that peer support is gone, but I would be very interested in having people actually trained as lay people to, in return for getting this treatment, giving this treatment to people who who receive it after them, and to really get it out of the money world of paying for therapy and insurance companies, etc., etc. But this will be a major challenge for our field.
Mm-hmm. I guess that's a cultural problem as well, as if suffering has been specialized into a certain field, and there you're going to get fixed, professionalized, right? So the local community doesn't really have a role in supporting the fellow man or woman.
Well, the local community, of course, is still there, but most psychiatrists and psychologists don't give any credit to the local community. And I think we need to be much more sensitive that therapists and psychologists are only a small part of the people who can help people to get better. That we have a relatively small part to play in this. And there's all kind of other possibilities, like 12-step programs. People can find healing where money is not involved.
Right. Yeah, that's interesting because, of course, maybe there's a sense of communities actually dissolving with the amount and increases of loneliness. Like the UK have their own minister of loneliness now, and we're kind of living in our own islands, so to speak. Do you think MDMA, or rather the movement with the psychedelic research and this form of thinking in terms of humanism and compassion for all, could that play a role in the mitigation of this development?
It's a very interesting question. It's a very good question to ask ourselves. Is it possible? I was certainly impressed that it came out in our conference last week, is that my own team is a team of disparate people from different backgrounds, and how deeply connected we are with each other, and how this work makes you very loving towards the people you work with. I've seen very little the stuff you usually see in academic environments of people getting competitive and hierarchical. I've not come across it very much. Up to now, it's been a very healthy, generous culture. I hope it's human beings, what they are, it's sort of almost too good to believe that this can persist over time. But I think MDMA has the potential of actually contributing to what you're talking about. We'll see. Human nature being what it is, it's tricky. Yeah.
Well, so I would like to just rewind a little bit what you said about, the importance of having an appropriate frame for doing this. Opening a Pandora's box is important for listeners who, may think, hey, let's take some MDMA. And also, when this is coming for psychiatry, and many doctors, I think, are still thinking of this mainly as, psychopharmacological treatment, in a way that there is a huge challenge in communicating the psychotherapy part of it, or the inner work that needs to be done to our friends in the medical field.
Yeah, it's a cultural shift, huh? Yeah.
Yes, right. And so, but one criticism is also, you said opening Pandora's box, but do MDMA open up too fast, too quickly? Is it safe? Is it advisable? Have you seen, for example, adverse events for people having opened up too much too soon and not being able to, repress it as functional?
See, actually, there's two issues here. But I find troubling is that now we are talking everywhere about how great MDMA is, but it's still an illegal substance. And I get emails every day, where can I get MDMA treatment? And I have to say, it will not be legal for another 2 years. So right now we're going too slowly. Huh? And so then the question is, what will happen if it goes too fast? And we'll lose control. So that's a question that we need to pay attention to and be very cognizant of. But you and I cannot control that. We can just put our stuff out there. As I said before, in our study, the map study of all these different sites, there was not a single serious adverse effect. But that's really because the protocol was so careful. I'm sure that if you start opening this up and become careless, that bad things will happen. And I'm also very worried that one bad experience may stop this whole process. And so let's, for God's sake, be very, very careful for now, so that we don't stop the legalization process. But let's also be very careful after that, so we don't open up too much. Yeah.
That relates also, of course, to the difficulty and challenge of implementation, because there are countless examples of treatments faring well in research, but then translating that to the everyday clinical reality. That's a whole different story. And you mentioned, of course, the community within the research setting being generous, compassionate. What would happen when this is going to be practiced, and how to implement it in a manner that maintain the integrity of the treatment, right?
Yeah, I think you should do some MDMA therapy with your Minister of Health and the people who make the policy, so you can really think very deeply about how to implement this on a policy level. And I think the policy people who make the rules should have the experience to know what they're dealing with also. Maybe in Norway that's okay to do. In the US, I'm not so sure.
Go ahead, Eva.
So another criticism is, this leap from research to clinical practices, things like the Hawthorne effect, or, this is new and the people involved is really engaged. And will this affect, do you think, can part of these great numbers that we're now seeing, can it be relatable to what we've seen earlier, like things performing very well in research and then after time the effects fade? So
it's a good question to ask. Of course, we won't know. It's something to be on the alert for. It's quite possible. As people loosen their standards and their training, it's very, very worth paying attention to. Mm-hmm. But I must say, for example, so my first entry into effective non-conventional trauma treatments was EMDR, which is about 20 years ago now. And I must say that EMDR does as well today in my hands and my colleagues as it did 20 years ago. I've not really seen it not work for people over time. So if we stay careful, it will probably hold its power. All right.
So how are we doing on time, Bessel?
I have an appointment in two minutes, actually.
All right. So just for me to say, it's been a real pleasure talking to you, and you have a lot of interesting points and interesting experience and data to show for, and we're really excited about the future and whether this treatment can reach as many people as possible who needs them.
Right. I'm delighted you guys are doing it and bringing it to Norway. It's wonderful, actually. Yeah.
Yes, I would also like to thank you for your involvement in this, and also all the other stuff you've been working on for all these years. So really a big thanks from our hearts to you, and looking forward to cooperate in the future, maybe on some exciting.
To see each other in person.
Yes, not to say the least.
That's great. Okay.
Great talking to you.
Thank you very much.
All the best.
All the best. Bye-bye.
Bye-bye.
Okay, Ivar, so we have had some time to digest this experience with Bessel van der Kolk. Just wondering, what are your afterthoughts after hearing what he had to say?
Well, so I remember immediately after the interview, I was just struck by how powerful of a testimony this is. From a person who has been really close to, the trauma field for a long time, been shaping it partly also, and who's been also very close to this treatment and seen it in action. So how he describes it is quite stunning. And that's also one of the words he uses. So yeah, it really made an impression on me, that part of it. Don't you think as well that he really used quite strong words?
Yeah, he did. And the comparison he made with all the different other types of treatment he's been involved with throughout the years, it was kind of, he underscored it quite emphatically.
Yeah,
Mm-hmm.
And in one way, it makes me in a way glad. It gives hope. It's kind of a confirmation when you're involved in this field and you share his sentiments and his appraisals of this. And at the same time, it's also a bit, I don't know, I'm also afraid that it can be off-putting, you know, because this is a typical criticism that comes that, you know, it's this hallelujah, how we call it, stemning in Norwegian.
Right.
You know, the hallelujah. What is it, stemning in English?
Yeah, like it's praise the Lord.
Yeah, it's like praise the Lord, stemning again. No, but I think people get the idea. But at the same time, I think it's really important that people speak the truth, you know. And I don't think there's any doubt that this is his experience, and it's also mine, and it's the experience of thousands of others. It's really a strong medicine. And the numbers are, you know, catching up on the clinical impression and giving more and more support to it. And that's the beauty of things when, you know, the clinical experiences from, you know, the old days before it was forbidden, and also from the underground community, and also what is seen from the modern era of research into this compound and this treatment modality really starts to align with hard numbers, with bigger RCTs, and also, you know, when we start looking at behind the numbers on the experiences, qualitative research, and also the subscales that he's referring to beyond PTSD symptom reduction, then it's also a nice confirmation of that it's not just like the praise the Lord, people being misled by something that seems very convincing, but it really doesn't hold its power.
It is reassuring that the numbers add up, and also that that they really apply quite methodological rigor in their studies. And also another point is how they are non-profit based. You know,
yes.
So many studies of different treatments, and especially in medicine, of course, are funded by people with interests, and it doesn't require much of a study, much of studies for a new drug to be approved, actually. So I think that is also kind of reassuring. And you mentioned these subscales and the research he was referring to with the subscales with the self-compassion scores and the alexithymia, which is quite interesting in particular because we know from other research that these constructs or these phenomena are really related to all kinds of psychological disturbances, right, across the board. One's inability to feel one's emotions, the alexithymia, being a quite a huge predictor of treatment failure, actually, right? And this ability to have self-compassion in meeting suffering also has been shown to be quite a protective factor to not develop further disorders or suffering or whatever we should call it. So that was actually quite intriguing.
Yeah, I totally agree. It gives a lot of hope that it can be a nice adjunct in other also conditions than PTSD, of course. If you can do something with like a self-treatment, he said that, you know, this is about who I am, and people can start relating to themselves very deeply and communicate also, both having a connection for themselves and communicate it to someone else is, you know, it's in the core of being human in the world, and so it really gives a lot of hope. But we have also inquired about the specific numbers in these scales, and unfortunately we haven't gotten them yet, but maybe we'll add them to the written interview later when we have them. But until now, if we just have to take him at face value, that the numbers are gigantic. And so yeah, so the second maybe main thing that I kind of was left with after the interview was that he quite rapidly he leaves the the clinical the world of clinical research and symptomatology and developing treatments within medicine to talking about implications for people having this experience on a societal level. Mm-hmm. And even though I hear him understanding when he speaks to, for example, that he wonders what this will do, like he imagines there will be forces against this kind of treatment because it alters the perceptions or the values of people, and specifically in a direction that can go against capitalism, like people who will not be willing to put so much effort into work anymore and be more into loving each other. And I think it's a very, like, to me it sounds like a very sympathetic way to, or consequence, or how do you say, virkning in Norwegian again. You have effect. To learn Norwegian, guys. Effect. It wasn't that complicated. Yeah, but at the same time, it's this slight uncomfort or discomfort when you politicize these things, because to me, I would like to, leave that aside. And if there is something like that going on, then it can go on, but I wouldn't emphasize it too much in this stage we're in, because, when these things were politicized last time, it led to a backlash. And I don't want to see that happen again on behalf of my patients. Mm-hmm. Mm-hmm. So I don't know, what are your thoughts on that particular?
Yeah, I agree. It can be dangerous to get into that kind of rhetoric at this stage, even though I can understand what he mean. I was just thinking about like Freud, for some reason, like maybe love isn't really diametrically opposed to work. Like he said, life should be work and love, But sure. I am wondering if it could be even more helpful to, at this stage, just focus on the raw data and the raw experiences of people, and to have the main goal to alleviate the psychological suffering in the first hand. And what happens politically, that's its own thing. It happens organically. And
yeah.
Then again, I can understand why he would speak about this, because this treatment has been so politicized in the past, and there has been a lot of misgivings and forces against it. So I can.
Yeah, and I think also it's good to mention that, of course, Bessel, he is not an activist at all. He is concerned with the raw data and the clinical, everyday realities of his patients, and so he's just referring to this as he's aware of this dimension, and he's a bit worried about it. So I guess, like us, but we don't want that dimension to come in the way, so to speak. So, and he's upfront enough to just mention it, where maybe I would tend to just leave that aside. So, but I think it's a good idea to just be able to name, or to say, to speak the truth.
Right.
So in that regard, it shouldn't be controversial at all to mention that and to be a bit worried about it. I would also like to reflect just a couple of minutes more before we end this after talk, after this great interview, with some of my personal experiences having MDMA therapy myself. Because what I saw was this some trends towards workaholism in me. That wasn't like completely new, but I could see the dynamics behind putting too much effort into work and struggling with a work and private life balance for a long time, and also seeing the compulsions that drove parts of this drive I've had, you know, coming from a place of anxiety. I mean, some of my engagement is, of course, just from, you know, this healthy place of, but part of it has also been driven from anxiety and regulating it, like any other compulsion. And I think, so I can relate to what he said, that being less preoccupied with work and more with love. That was for sure one of my main experiences. But that being said, you know, that doesn't mean, you know, I'm hanging around in some park eating flowers or putting them in my hair or whatever. And I've also read, you know, this myth about if the hippies, like some of them, of course, to drop out of society was a big thing. But if you look at modern data, people have taken psychedelics, they tend to be very involved and engaged in the society, you know, more than the average person. So I really don't think there is a threat there. I think there is just a potential that people could maybe invest their energies in more healthy directions and not been so driven by, you know, I heard some anthropologists talking about if somebody came from another culture, from another time to study us in our Western modern culture, they would really pay a lot of attention to this ritual that we call work and how much meaning we've been able to put into this ritual. And it's really a, you know, a astonishing thing, you know, we are so used to it, but that work has this big place, and work has, you know, instead of religion, you know, we find meaning in work, and also, you know, two people in both the father and the mother in the family supposed to work, and kids in kindergarten and so forth. So I think there is an imbalance there. We put too much into it, and if these medicines, or if MDMA helps us really connect on a deep level with ourselves, maybe some of that imbalance will be adjusted. But I don't think it will be dramatic for capitalism. I think it will prevail.
Right.
For sure.
So maybe the work won't be less, but maybe people are drawn or attached to different kinds of work, which they find more meaningful, right?
Yeah, and that will drain them less.
Yeah, it just reminded me of some criticism against meditation as a fear. If you meditate, you will detach from the world, and you will turn passive in terms of the suffering of the world, for instance, because you would just non-reactively detach from it all, right? But which goes against what people actually experience, right? Because there's not an opposition necessarily between being able to non-reactively observe what's happening in your life and detaching from society, right? Often it is actually the opposite that happens.
Right. Yeah, for sure. You can touch base on a deeper level, or not a less reactive level, and the reactive level is much more conditioned from our, you know, both the microcosmoses we've been living in our families and all that, but also the larger culture. And it makes it possible to actually take a more personal and conscious decision of how to relate to these things.
Right. So like in not being slaves to our experiences, which are still lingering on in our bodies, and not being slaves to the monkey mind.
Right. So maybe that should be the closing words. I would like just briefly at the end to say that, you know, my involvement in this field and also I'm sure Bessel founded Kolks is really about the simple thing that you sit with people in suffering every day, and you're so glad, and it's so profound when you reach someone and you reach their family and the generations that will come after. And it's such a, you know, it's such a fulfilling experience to be able to reach and be witness to healing processes. But then again, how painful, you know, to all those we do not reach with existing methods. And obviously we need, you know, this menu of different treatments that can meet different people at different stages of their healing process and development, and
sure looks like MDMA-assisted psychotherapy will be one such avenue that will be important for at least some people. So yeah, go. Hope people will, you know, look more into this modality, get more knowledge about it, and possibly support it. Yeah. All right. Bye-bye.